This is a presentation on motivating older veterans to use telehealth services for the iReach program.
First, a quick acknowledgement that this project was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, and a disclaimer that the contents of this presentation and myself do not necessarily represent the official views of, nor an endorsement by, HRSA, HHS, the Department of Veterans Affairs, or the U.S. government. In this presentation about motivating older veterans to use telehealth services, there are three main learning objectives. So hopefully by the time you have finished watching this presentation, first you'll understand some of the main barriers that older veterans face to accessing telehealth services. Second, hopefully you will understand the benefits of telehealth for older veterans in such a way that you can convey and maybe help veterans understand those benefits. And then lastly, understand how to help older veterans prepare for telehealth visits in such a way that might combat some of those barriers that exist.
First, understanding barriers to telehealth. It's important at the beginning to be aware or recognize any assumptions that we might be making about why an older veteran may be reluctant to use telehealth services, or why someone is resistant to doing it after suggestion. And so to get away from that or avoid that at the beginning, it's important to practice empathy and make a true conscious effort to try and understand what are the key barriers for each individual older veteran that are getting in the way of them using these types of services. And so it's important to consider that for each veteran. However, some of the common barriers that have shown up both in practice and in research in the past include lack of access to technology, the equipment that's needed, lack of access to internet for telehealth services, or even just slower internet speeds could serve as a barrier, lack of experience with the technology that you would need to conduct this appointment, hearing, vision, or communication impairments that might make it more difficult or might make the veteran feel more concerned or self-conscious or even nervous about the ability to effectively communicate over telehealth. And then lastly, cognitive impairments that might also serve as a barrier for conducting a telehealth appointment. Okay, so if you are working with an older veteran and you're trying to help motivate them to consider using telehealth services, it may be helpful to highlight the benefits of telehealth for that person. And so first, there's a few direct benefits that you can highlight, and that includes fewer trips to the office and clinic, which leads to obviously reduced exposure to illness, which is important, but at the same time, fewer trips to the clinic also means fewer trips outside the home, and that can be important if mobility is an issue for that veteran. Sometimes with telehealth appointments, you can actually get an appointment sooner than you can if you have to schedule it and attend in person, and then there's no additional cost. So those are all good direct benefits. And then it's also important to highlight what can you actually do with a telehealth appointment. People may not have a full understanding about the scope of services or the scope of assistance that you can get with telehealth. So there's a whole list here, includes checking blood sugar with your physician, checking high blood pressure with a physician, showing a physician any skin concerns like rashes, swelling, or bruising. You can demonstrate walking or walking with a cane. You can talk to them about your supplements or personalized nutrition goals. You could demonstrate ranges or restrictions of motion. Again, going back to the mobility, if with a video feed you can show them all these different things and they can give you feedback or get an assessment over video, even if it's not in person. Same thing with a video feed, you can work with a speech therapist. So, veterans can, while talking, they can demonstrate muscle movements that can be observed by a therapist. A therapist can also observe any other muscle movements related to swallowing or any other kind of verbal tics that might be an issue. You can also encourage veterans to use telehealth services to connect with other veterans, in groups, support groups, those types of things. And then lastly, telehealth services are available for both pre-op and post-op surgeries, or pre-op and post-op for surgeries. So going back to the original point of direct benefits to veterans, reducing the number of trips needed outside the home and to the office or clinic. Okay, lastly, preparing for a telehealth visit. There's several things that you can do if you are a person trying to support or encourage a veteran accessing telehealth services. So one thing you can do from the very beginning is just consider whether a phone-based appointment is sufficient to address whatever clinical need is going on. If it's the case where a phone-based appointment would be fine and video isn't needed, that could reduce some of those barriers that are associated with technology, accessing technology, and navigating and all of those things. So that would be one thing to consider from the beginning. You could also provide support. It'd be important to provide support in setting up all the equipment and technology beforehand, even if it's the first time, maybe not every time, but the first few times until someone can become more familiar with that equipment. That would be helpful. You can also provide support by reviewing or walking the veteran through all of the steps related to accessing the appointment. So how to actually open it up, how to use it, how to navigate the technology when the appointment comes up. And with that being said, it is important, and this is something that you could do from the beginning beforehand. It'd be important to test all the different components, like the video feed, the audio feed, volume, all of those things, and even the internet connection. Testing all of those things beforehand so that, again, you're reducing the barriers of maybe technical difficulties that could come up that might make it difficult to follow through with that appointment or decrease interest for appointments in the future. When it's a possibility, it is also nice to provide detailed step-by-step instructions on how to do everything. Even if you go over it beforehand, even if you follow through a couple times, having that as a resource could, again, reduce some of those barriers if a veteran has a detailed step-by-step instruction list on how to do all of these procedures, or all of the aspects related to accessing a telehealth appointment. And then lastly, when it is possible, if the veteran can have on-site support, ongoing on-site support during the appointment from a caregiver or a family member, then obviously that could further reduce any other barriers that may pop up.
Thank you very much for listening to this presentation. Please feel free to check out all the other presentations and modules of the iReach program along with the fact sheets. There is one fact sheet linked with each presentation, which also includes additional resources and suggestions. Thank you again.